record. There we go. And maybe Luke, just for the benefit of the recording, would you just quickly introduce yourself again?
Yeah, absolutely.
Thank you.
Let's see if it's consistent with what I said before. Hey, everyone, I'm Luke Shaefer. I'm a professor of public policy at the University of Michigan, and I run Poverty Solutions here at U of M, a university-wide initiative that partners with communities and policymakers. My very, very good friend Nicole from the Michigan Department of Health and Human Services, who's been a deep partner on RX Kids and a lot of other work, is here on the line. And RX Kids is our sort of biggest endeavor and the thing that brings me the most joy in my work life, done in partnership with Mona Hanna and the Michigan State University team in Flint. Aditi?
Thanks, Luke. Hi, everyone. I am really delighted to be joining in this conversation today. I'm Aditi Shrivastava. I use she, her pronouns, and I am Deputy Director for Income Security at the Center on Budget and Policy Priorities, which is a lot of words altogether. The thing to know is that I spend a lot of my time thinking about TANF and thinking about how TANF can be improved so that it is structured in a way that is as unrestricted as possible, so that it can best serve the needs of the families that access it. And I'll stop there for now. And I'm not sure who I'm handing back to. I think maybe Luke.
All right, looks like Kim's giving it the thumbs up. I have a little bit of a PowerPoint. It's only a couple slides that'll just be helpful. Thumbs up if you can see it. I'm looking at Kim. Kim, you good? Oh, Pete beat you to it. Great. So RX Kids is a citywide maternal and infant cash prescription program. It builds off the incredible evidence base of child benefits and child allowances. So I think over 140 countries have some sort of child cash benefit. Over 40 have a sort of a almost universal or universal program. Many of these countries have had these types of programs for decades. So the United Kingdom actually for decades, for example. And they just start from a very different logic from a lot of our safety net programs here, that raising kids is expensive. And society has a reason to come alongside parents in that work. And one way that can empower families is a little bit of money to be used for diapers or books or toys, to pay for food or pay for rent. So when I think about cash transfers as sort of a policy intervention, I consider myself personally like UBI curious. I'm very interested in the ways that UBI can be rolled out. Should we do it for segments of the population, or should we really do something for everyone? And I think this is a wonderful place for us to be doing small pilots and really trying to figure out the best ways to do that. With child cash benefits, I think the evidence is in a very different place. And we saw that here in the United States with the expanded child tax credit of 2021, where we saw child poverty plummet, just like it does in other countries that roll out a child cash benefit. We saw food hardship decline to the lowest level ever recorded in a couple decades. We saw the number of families with bad credit fall to an all-time low. We saw improved mental health of parents, for example. So just, it was a short duration, but we saw over and over again the same success replicated here in the United States. But of course, it wasn't renewed. So the most wonderful day in my work life, as probably some of the others of you, was the first day those payments started going out. And then the worst day was when it became clear it wasn't going to be renewed. So in the wake of that, though, if you think about where should we intervene, like if we don't have the money to do everything. So just to sort of back up, I'm despondent, child tax credit wasn't renewed, and I get this call from Mona, who says, hey, we want to do this, and we want to do a child cash benefit in Flint. And we started to do the math, and Flint is not a large city, but still the numbers get really, really big very, very soon. So we wanted to follow the evidence and figure out if you were going to intervene at one moment during the life course, right? If we had enough money for sort of one time, what would it be? And we really came, because of this incredible work at the Center for Equitable Growth in Washington, to identify the period surrounding childbirth as sort of this moment of acute economic need. So we see family income drops before childbirth, hits its sort of trough right around childbirth, and then slowly starts to recover, but still is below where it was to begin with at age 1. And if you were really going to intervene in one moment of this, right, it would be the last few months right before childbirth and the first few months after childbirth. And the international evidence really supports this too. Actually, I think one of the places that we have the strongest evidence base is that providing cash benefits to expectant moms in the last trimester, as you heard, another great example of one of our partner initiatives, can really improve birth outcomes and can really impact the life trajectory there. And of course, that first year of life, baby's brains double in size and just so much development happens. So another big indicator is child welfare. So, here's the sort of rate of child maltreatment, sort of engagement with the child welfare system, which is virtually all neglect, which is highly correlated with poverty. You can see before age 1 is the time when kids are most likely to get enmeshed in this system. So RX Kids sort of started on the incredible success of the expanded child tax credit, and then looking at the numbers and thinking, all right, it's just impossible. It's the numbers to do this for every kid as much as we would like are just too incredibly high. Funneling down into that first year of life, and then really do a significant planning and sort of getting the charge from a group of parent partners. The Flint Youth Justice League is a group of youth that advise us, a set of engaged mom consultants who have sort of been a part of our work since the very beginning, and then information from the Flint registry that came out of the Flint crisis. So you can see actually here is me with all the moms, my little head sort of peeking out there. And it was a great session where we learned a tremendous amount. All right. So I think some of the things that sort of make it different is the fact it's not a lottery. That was something that was important to us given where the evidence base is, right? I think lotteries are super, make a ton of sense if you're in a place like Chicago, where you couldn't possibly do everybody. Makes a ton of sense if we're talking about sort of UBI, where we still want to learn a lot about the best ways to harness the benefits of cash. But for a child benefit, we really wanted to do this for the whole community. It also really allows for sort of a second piece, right? So RX Kids is not just about the money, but also about the messaging and about sort of narrative change that's possible by now Flint has become sort of a national leader in how we care for our youngest and most vulnerable kids. So if we think about the shift of where media coverage of the city of Flint has been for the last decade, and now there are so many articles about how Flint is doing something nobody else is doing and caring for its kids in a different way. So here's the design. We've got a one-time $1,500 payment in pregnancy available to pregnant people after 20 weeks gestation. And this $1,500 really targets the pregnant person, right? So this money is going to the pregnant person no matter whether the child is born or not. We also have a sort of a bereavement policy, which I can talk about if anyone's interested in the details. And then $500 a month through age 1. And the eligibility requirements are that you reside in the city of Flint. You have to verify pregnancy and you have to verify childbirth. And that's it. Is available to anyone at any income. And we're going to come back to that, the TANF funding there in a second. So it's universal and unconditional. It has very much sort of this type of narrative, structure of child benefits, that raising kids is expensive and society wants to come alongside parents in that work rather than you're poor and you can't handle your business. So we're going to make sure you're really poor and then we're going to give you, a little bit of money. It's no strings attached. And then it is provided by Give Directly as a gift rather than income. I think probably a lot of you are familiar with this, but with the mixing in of private philanthropic dollars, we're able to protect virtually every benefit save SSI, and we're working on that. It also becomes incredibly easy to administer. So we have about a 10-minute application. It takes somewhere between 10 and 15 minutes for families to apply. They can get it either into a banking account, which about 70% of families choose, or a reloadable debit card. So the TANF funding comes from non-recurrent short-term benefits. This allows states to offer up to 4 months of benefits funded by TANF to address an acute economic crisis. So Aditi is one of our sort of national leaders in understanding this. We've been so lucky to have a brain trust of people who have helped us sort of navigate this. But states use this sort of stuff in a lot of different ways. Diversion programs comes out of this statute. Uh, some states provide kinship care type supplements for a short amount of time. School close. So states have given a really broad ability to sort of define this in the ways they want. So ACF, I'm sorry, this is a typo, obviously, but we defined childbirth as an acute economic crisis, right? So the period, just because of that chart I showed you, right, where income drops to an all-time low in the months before and then rises slowly, we define childbirth as the acute economic crisis, and then TANF can be used to pay for 4 months of benefits for needy families. As you all know, there has to be sort of a means test, but the law gives a lot of flexibility in that. So in wanting to streamline things and make it as easy as possible to take something that is well measured, especially around birth, we defined Medicaid coverage as the means test. So our NRST that's been approved by OFA allows us to pay for 4 months of benefits, those sort of green boxes there. The $1,500 payment right before birth, and then the $500 a month for the first 3 months. And then our philanthropic dollars sprinkle on top of that for those first 4 months for higher income families, and then pays for the remaining 9 months up through age 1. So this was implemented in Flint in January. The first incredibly exciting thing is we actually have 100% take up at this point. So because we have vital records, we know exactly how many babies have been born from birth certificate information, and we're getting everybody. I think we've missed a handful of people who are on SSI and decided to opt out because it would put their SSI benefits at risk. But in most months, we're getting 100% take up. Another thing is actually we're starting to see survey data come in. We're able to compare families in Flint over the last couple of years to families outside of Flint in the surrounding region. And we're already starting to see some pretty impressive what look like impacts on reduced back rent owed by families, improved sort of satisfaction with their food, so more ability to have the types of food that they want over time, and more expression that they have sort of enough cash to have freedom in how they spend it and how they allocate it. And then a series of other really exciting impacts. So I'm going to stop there, and I know we wanted to have as much discussion as possible, but that sort of gives you the lay of the land where we are. I guess I'll just mention also that the state budget for the coming year allocated $20 million additional dollars that can be used to expand the program. So it appears that we are likely to expand to the Eastern Upper Peninsula, to Dearborn. We're in discussions with folks in Pontiac, Michigan, and Detroit and Kalamazoo. Thank you.
Kim, did you want to have some questions right now for Luke, or should we go into mine and then?
Let's go into your presentation and then we'll stop recording and open up the floor.
Okay, I forgot about that part, thanks. Okay, so I need a minute to get my presentation shared. And as soon as I begin sharing, I'm actually going to no longer be able to see anybody in the Zoom room. So if folks could let me know that you're able to see, let's see. So are you seeing just my presentation right now and not, oh, not yet, hold on.
We just see your face right now, which is
Okay.
lovely. But now we see your presentation.
Okay, so now you're seeing the presentation, and I need to figure out where on my computer I can run this. Okay, so you're seeing just the presentation and not like the next slide and stuff, right? Okay, brilliant. So I I'm very excited to be following Luke. I have to say that Luke and Mona have thought through how to do this in such a deep, thoughtful way that it's really nice just to hear how that thoughtfulness can occur, right? Because that's what I want to bring into this conversation today. When you are thinking about what's happening in your state and what's happening in TANF in your state, how do you go about exploring that world of what is possible? Because RX Kids has happened because two people came together and really pushed the limits of thinking about what is possible within what this program says can happen. So I want to have this conversation today about TANF and what's happening in TANF. Unless you follow it on the day-to-day, which hopefully many of you don't have reason to do, what you've missed is that in maybe the last year and a half, we've actually come across this moment where there's, for once, is a lot happening in TANF, right? There's been legislative changes, there have been administrative changes, and what that's led to is that there's this moment that can be seized, right? State agencies and other advocate groups can take this opportunity to really push this moment in a better direction, to really think about what it is that families need and really center them when we think about where TANF goes from here. Because we really are at least what I consider to be an inflection point. And I like to think that all of us in our virtual room together really all want a cash assistance program that enables the families who need it to meet their basic needs, right? And note that I did not say TANF cash assistance, I just said cash assistance, right? Because RX Kids is also getting to that same end purpose. And there can be many different ways to get there. So today I want to talk us through two different options. One is the NRSTs, which is what Luke mentioned. And then the second, even though RX Kids is referenced as a pilot, I'm going to talk about a different TANF pilot that has become available. So let's talk a little bit about what are NRSTs. They are non-recurrent short-term benefits, and the name itself has all of the requirements that are codified in the statute, right? It is three requirements, just three requirements, right? That it is designed to deal with a specific crisis situation or episode of need. Okay, so when you think about that, think back to what Luke was saying about what was that episode of need that they defined. The second is that it's not intended to meet recurrent or ongoing needs, right? And the reason for that is because TANF cash assistance is intended to be recurrent and to meet ongoing needs. And so NRSTs need to be meeting something that is not recurrent. Families are not having babies over and over and over again for an extended period of time, right? And so you can define thus a baby being born as a single episode of need. And then finally, that it will not exceed 4 months. That is just something that has been written into the law. It cannot be changed, but you'll see that there's a little bit of flexibility in how that happens. The key takeaway for you to keep in mind when you think about NRSTs is that it is 100% up to states to actually describe how each benefit or service that is provided as an NRST meets each of these three criteria. And that's where there ends up being a significant amount of room for creativity and thinking about what happens. And I think what I want to name, and I'm going to do this with deference to the fact that we have colleagues from OFA in the room with us right now, is that it has certainly seemed like OFA right now is positioned to encourage that flexibility and that creativity, right? And to encourage what more is possible when it comes to really meeting families' needs and using NRSTs to meet them. So when you think about providing NRSTs, right, why would you do that? TANF funds are there. You could be doing TANF cash assistance, right? There's a few different reasons why NRSTs can be beneficial. The first is that they're already written in the law, right? They're a vehicle that states can already use to provide cash and other services to targeted families. An important thing to note is that they can be administratively simple when you consider how many families are actually already known by your state. pandemic happened, under ARPA funds, TANF got an additional $1 billion, and all of those dollars could only be spent as NRSTs, right? So that didn't mean that only TANF families could receive them, but it did mean that TANF agencies could only spend them as an NRST. And very frequently, what we saw was that those funds were made available as one-time payments or as 1 or 2-time payments to, as an example, TANF, but also SNAP families, right? Because states already know who their TANF and SNAP families are, and so sending them an additional check is actually relatively simple to administer. So when you think about what is possible with NRSTs, and if you are thinking about reducing that administrative burden in your state, one thing to consider is who are the families who are already known to your state, to your agency, and then thinking about what it is that they need. And that second question of what they need is going to come back to when you think about what is possible in that universe of NRSTs. The other thing that is really important about these benefits is that they don't come with the requirements that accompany traditional TANF cash assistance. So if you get ongoing monthly cash assistance, there are work requirements. And what we hear from families is particularly difficult to navigate is child support enforcement requirements, right? These two requirements do not happen if you are administering TANF as NRSTs. So it's a little bit less, or actually not a little bit, it is significantly less cumbersome that way for the families who are receiving the benefits. And so the key takeaway that I want for you here is that states can determine their own eligibility criteria for NRSTs, and that they can opt to provide multiple to a single family or to families who meet different eligibility thresholds than those who are already receiving TANF cash assistance. So I'm going to go through a list of what some states are already doing. And what I want you to know there is that the eligibility criteria each time can be different. And also, a single family can receive assistance more than once, and that is all defined by states, right? So every state gets to pick, does one family get benefits more than once? If so, is there a lifetime maximum? All of those are policy decisions that states can choose to make. And I guess the only other thing that I'll say here is that in recognition that the NRSTs have a lot of flexibility, the only other time that TANF has gotten additional money from the federal government was during the economic recession during the Obama administration. At that point, TANF had gotten $5 billion additional dollars, and that was only spendable in 3 categories, and one of them was also NRSTs. So we've seen that there's recognition that this is a space for innovation more than once. So when we think about what examples of NRSTs can look like, it's important to know the history here, right? So prior to TANF, there used to be a program called AFDC, which was an entitlement, and AFDC had a component called diversion, right? So diversion, it's in the name, families that were coming to receive cash assistance if they were able to not have to go on ongoing assistance. If a single payment would help them stay off of assistance, then agencies had the option to provide that. So many state agencies today continue to provide some sort of diversion, and that can just be cash benefits. It can be a single cash payment. Now, it is worth naming that some states do then have certain restrictions in that a family that receives it can then not come on TANF cash assistance for X number of months, or that there can be a lifetime limit of receiving X number of dollars as diversion payments. But it is a way that families can receive unrestricted cash through TANF funds. The second is RX Kids, right? Luke already pointed this out, that there is that they're able to provide 4 months of part of 1 year of payments as to new parents in select places in Michigan. Inspired by RX Kids, there is another program that is going to be launching in a more conservative Midwestern state. They have asked not to be identified at this point, but they are going to be providing one-time $3,000 payments to low-income expecting or new parents, depending on when families find out about their program, to up to 5,000 families over the next 2 years. So this is very exciting, right? once again, it's unrestricted cash, and they are anticipating being able to launch this by the end of the year. So this one is also very much forthcoming. And then either currently or sometime in the past, we also know of other states that have provided unrestricted cash. So Luke mentioned this briefly, right? There can be a clothing allowance. So while a state may call this a clothing allowance, it actually just goes out as cash, right? And again, that question that I asked earlier, right? What is it that your families need? If you live in a state like Massachusetts, which has very cold winters, and we all know that children grow very quickly, right? Every year when winter comes around, do your children have sufficient warm clothing, or have they outgrown that warm clothing? It's really in recognition of that episode of need that the state opted to provide a clothing allowance, right? Which is a cash payment to families to be able to spend towards clothing. For ease of administration, our understanding is that all of these benefits are provided just unrestricted, even though it's said that, you should be, it's called a clothing allowance, but they're not following up to make sure that it is spent on clothing. So in effect, it ends up being unrestricted. Similarly, back to school allowance, when you have kids going back to school in the fall, that can be an added expense for families. So we know that Oregon and Texas provide back to school payments there. And also just this concept of emergency assistance, which is providing one-time assistance to families for a variety of emergencies. And that isn't always like specifically defined, just in recognition that there are unique families that face unique circumstances. And you can see that a couple different states provide that. Then NRSTs can also be provided as in-kind benefits and services. And I want to name this only because while these are more restricted, passing benefits like this can be a little bit more palatable in more conservative states. So here we know that some states opt to provide emergency housing assistance. This can be either mortgage or rent arrears, or just like housing stabilization services and emergency shelter services as well. Other sorts of crises and episodes of need that families face, right? Utilities and energy assistance. Again, if you're living in a very cold state and losing heating in the winter actually becomes a safety issue, right? Going back to thinking about what is good for the children, right? Like, what are the things that would get your child welfare agency involved? If you can just pay their energy bills, that can solve a family's problems right there. So you have utilities and energy assistance, domestic violence services, right? Sometimes people who are escaping a situation of domestic violence are not able to do so because of a lack of funds, right? And so being able to provide both some cash assistance right there and then also other services can help stabilize a family in a very critical moment. Similarly, keeping a job in places in parts of the country where there is not sufficient public transportation requires a car. But if you have an old car that has broken down and that's what's keeping you from being able to keep your job, there's another one-time crisis, right? Episode of need that a family may need meeting for. And so states can provide vehicle support, even sometimes, or other forms of transportation assistance. And then the other one, just worth putting in here because I think it really shows that there is a lot of room to think about what are the episodes of need that show up, is burial assistance, right? And again, when you frame this in what it is that kids need especially, right? If you have lost someone close to you, particularly if you have lost a parent or parental figure, being able to have a culturally appropriate farewell for them can be really significant. And so that is another sort of benefit or service that can be provided through NRSTs. So the final thing that I will say here is that states choose whether and what sort of NRSTs to provide to TANF and other families. This is 100% up to states. Every state right now is very unique. All TANF programs are very different. And so I can't say uniformly that this state does or doesn't, should or shouldn't, and how it is structured in there. Because of course, all of these take TANF dollars, and TANF dollars are limited because TANF is a block grant. But that being said, there are many states that have reserve TANF funds, which is prior year federal funds that have rolled over into the because those funds never expire. And so many states are in a position where they could explore setting up additional services. So I'm going to move now into the second piece that I was going to talk about, and this one will be much briefer, and that is just the TANF pilots. So when the debt ceiling negotiations happened last year, part of what was finally agreed upon was some changes in the TANF program, one of which was very exciting, and that is that starting this year, up to 5 states are going to be selected to engage in a pilot program. And this is for their cash assistance program, right? So this is not NRSTs, which are separate from cash assistance, right? This is for their core TANF program. 5 states will no longer be measuring their work participation for TANF participants, and instead be thinking about work and family well-being outcomes. This is huge. And I know I've been talking for a while, but this is actually really, really big, because one of the biggest criticisms of TANF has always been that it measures what people are doing right now, rather than whether they're being set up for success in the long term. And these pilots are creating that moment of state agencies being able to define how to set up a program so that they are being so that families are being set up for success in the long term, and what is being measured is those long-term outcomes. I am talking in very broad strokes right now. There are a lot more details in the application, and I will drop that up, and I will drop that link later for anybody who is interested. But I think when you're thinking about creativity and possibility in TANF, states right now really, really have an opportunity to design family-centered and family-driven programs, to really go back to the drawing board and completely reconsider what TANF can do for their families. And it's actually incentivizing serving more families, right? Thinking about who it is who your TANF agency is not able to serve right now, and to actually reach out to them, to actually bring them in and to give them what they need. So that application is open until September 3rd, and I just want to put out there, because there are so many state and other local agency folks, that if you don't know whether your state TANF agency is considering applying for this, we strongly recommend that you think about it, about just checking in with them to see if they would want to apply. We've been meeting with many states to talk through what the possibility there might be. Because, I mean, just again, you get to redefine from scratch, if you want, what your TANF agency can do. And that is a moment that has not occurred in TANF since TANF was created. So I'm going to pause there, and hopefully I haven't bored everyone all the way.
Absolutely not. Could I ask Bianca to stop the recording, and then we can sort of open it up for discussion, maybe before